I think the first thing I noticed, I started to run out of breath doing some of the work I normally do in the back. And about 3 weeks after that, I developed a cough.
I was half out of it. I don't even remember half the things that were going on at the time, just my family coming in and out, and definitely scared knowing that it was the same heart condition that my brother had 10 years earlier.
And she was the one that was pushing me, get into the doctor and get it checked out. If it's bad, let's get it fixed.
Heart failure affects over 5 million people in the United States, and there are 500,000 new diagnoses each year. Heart failure has many faces and affects all ages and both genders. It can impact anyone. You likely know someone with heart failure. You could even walk by someone with heart failure and not even know it.
The diagnosis of heart failure, of course, means that the heart is not functioning as well as it should. So at least initially, there's going to be a decrease in activity level, enjoyment of daily life.
The experience of heart failure can come on suddenly, or it can build up gradually. Recognizing the signs and symptoms of heart failure can be the first step to seeking vital care. Some of these signs include shortness of breath, waking up breathless at night, the inability to lie flat, weakness or fatigue, persistent or frequent cough, swelling of the ankles, feet, or abdomen, or a sudden weight gain of 2 to 3 pounds or more in a day.
Bob developed a cough that was just a racking, very fluid cough, and I thought he had pneumonia. He could not lay down. If he even reclined slightly, this coughing would just, rack him. His color was not good either. He had a very grayish tone, which was kind of in the back of my mind too, that something might not be right here.
We did notice the swelling in the ankles, but it looked minor to me. It kind of looked like I'd been on my feet all day or something. But the swelling in the abdomen was quite a bit different.
I woke up in the middle of the night coughing, feeling like I had the flu. And then when I woke up the next day, I was having a hard time breathing. And especially at night, I would lay down and, practically felt like I was being held underwater. It was so bad.
I started shortness of breath. I used to walk 2 miles a day, and then it got shorter and shorter and shorter, and got harder for me to walk.
Recognizing the signs of heart failure is an important first step in seeking medical help, and are the same signs that indicate you need a return visit to your doctor. The term heart failure can be frightening, but does not mean your heart has stopped working. It means you have altered heart function and your heart has lost some of its pumping strength. Once your doctor tells you that you have heart failure, you may experience a variety of emotions and concerns.
Denial is a big thing with me, and I deny the symptoms, and that's what I did.
Honestly, I don't think I took it as seriously as it actually was. It took me a while to realize that it was, I just figured they'd give me some medicine and I'd be better in a couple weeks, and it was a slow process for me to realize that this was a lifelong change.
How well you manage your heart failure will greatly influence your ability to return to an active lifestyle. Heart failure will be with you for life, and it means you need to play an active role in taking care of yourself. With treatment and lifestyle changes, you can help your heart work better and help yourself feel better. Your healthcare providers will help you learn the tools to accomplish this.
With appropriate medication, working closely with your doctor and the rehab specialists, we often can get you back to full activity and an excellent quality of life within a few months.
I wanted to see if my medication list is all correct.
Your doctor will prescribe medications to control your heart failure. Because each person is different, Your doctor will decide which medications are best for you.
In this condition, there are 4 or 5 different classes of meds that are absolutely necessary. And if we adjust those appropriately, take them, and get our patients to be compliant and take them religiously, we have a very good chance of keeping them out of the hospitals.
Some medications may help your heart pump more effectively, and others help to decrease the workload of your heart. It's very important for you to know your medications and to take them as prescribed. Even though you may start to feel better, it's important to keep taking these medications. Never stop abruptly, as you could make your condition worse.
Taking medication for 6 months and then going off of it would be one of the worst things they could do. So it is a commitment.
Remember, heart failure cannot be cured, but it may be kept in control with proper medications and lifestyle changes. The same symptoms that caused you to seek medical attention could reoccur if your heart failure gets out of control. You need to watch for these signs: shortness of breath, inability to lie flat, increase in swelling in your ankles, feet, or abdomen, increased weight, extreme tiredness, very fast or irregular heartbeat, chest discomfort, or lack of appetite. These could be signs of increasing water weight, and the main reason it is so important for you to weigh yourself daily. An increase in weight is one of the first signs of increasing heart failure. One of the most important things you can do is to weigh yourself every morning before you get dressed and after you use the restroom. Record your weight on a calendar and get into the habit every day of doing this. Plan with your doctor when to call for increased weight gain. Generally, if you gain 2 pounds in a day or 3 to 4 pounds in 4 days, you need to call your doctor. You may see weight gain before you feel symptoms. Intervening early will help you manage your heart failure effectively and keep you out of the hospital. Quitting smoking is one of the most important changes you can make to improve your overall health. Smoking deprives your heart of much needed oxygen, damages blood vessels, raises blood pressure, increases the incidence of clots, and makes your weakened heart work even harder. So if you smoke, now is the time to quit. Your healthcare providers can put you in touch with resources to help you quit and assure your success. Share will contact you and follow you for a year or more to help you quit. They will provide phone contact and mail information.
Very healthy and nutritious.
Another helpful lifestyle change you may need to make is the adoption of a low-salt diet. Remember, where salt goes, water follows. This shows up as shortness of breath, swelling in your ankles, and a weight gain on the scale. Tell your physician if you have these symptoms. Take the salt shaker off the table and place it in a cupboard out of reach, or better yet, toss it out. Try using other spices to season your food. You need to keep in mind that there are hidden sources of sodium. Many processed foods are high in sodium or salt. You will need to get into the habit of reading labels and making the best choices. Check the salt per serving to evaluate whether an item is a good choice. If you are going home on a low-salt diet and need more information, let your doctor or nurse know you would like to be seen by a dietitian.
You can bring that over.
Some people think that with a diagnosis of heart failure, you should not be active, when actually the goal is for you to remain as active as possible. Staying active may lessen your symptoms and improve the way your heart works, as well as just make you feel better. You will have days when you feel very well and others when you are more tired than usual. You will need to plan in rest periods between activities. It's important to listen to your body and to stop activity if symptoms indicate.
We'll take those from you.
Managing heart failure is a collaborative effort with you and your doctor. Keeping follow-up doctor appointments is important for monitoring your progress and checking on the effects of the medications prescribed. Your heart failure treatment plan and follow-up schedule will be tailored for you and allow the most effective medical management possible. Heart failure is a condition that is with you for life. You can manage your heart failure effectively by taking an active role in your treatment, by knowing the signs and symptoms to report to your physician, taking your medications as prescribed, weighing yourself every morning, and if you smoke, quit. Monitor the amount of sodium in your diet according to your doctor's recommendations. Maintain an active lifestyle as you're able, and follow up with all scheduled doctor's appointments.
They have a lifelong condition. Again, we want to be optimistic. It's very treatable. So don't get discouraged. There's a lot of good life ahead of you.
I've just, for the past 7-8 months now, I've been working full-time. It's going great. It's great. I didn't know if I was ever going to be able to do it again, so it just feels really good.
I'm 120, 130% of what I was before. No lack of energy, no symptoms of coughing, definite improvement. So I'm fully physically capable of doing everything I did, before the heart episode.